It is time for our PadWarriors Tell All segment. It's where our fellow PadWarriors are going to get to share their stories and the lessons they've learned along the way that will not only help PadWarriors, but also help the industry, doctors, clinicians, and researchers to help us, to help all of you PadWarriors in the long term. We have with us Dr. Fadi Saab with Doctor, I think I see you there. Dr. Fadi Saab is here, who is with ACV Centers out of Michigan. Doctor, do you want to say a quick hello?
Yeah, hello everybody. Thanks for having me. This is really exciting. I met Kim a while ago, and she talks about the community, and to be truthful, I was really eager to meet some of you, and I asked him that maybe you guys can teach us some things that it will really be helpful when we take care of other patients in the future. So really excited to be here.
Great. Thank you so much, Dr. Saab. And I want to let all the doctors know that this is really a free-for-all. I see amazing world-renowned researcher in PAD. I just want to give a shout out to Mary Yost is here. Also Jim Wilson with CSI, Cardiovascular Systems Incorporated. They make an orbital atherectomy device. We talked about the removal of plaque. That's one of those devices. And he also is in charge of the Stand Up Against Amputation. If you've seen their movement to support PadWarriors as well. Jill Somerset, our technician, is here. She can also jump in at some point with questions. And of course, Dr. Gupta, Dr. Antizana, and Dr. Andandu, you're welcome, as well as Dr. Saab. But I want to start off, our co-host, PadWarrior, is actually Rodney. So I want to welcome Rodney in here. Rodney, say hello.
Hello, everybody. I am so pleased to be able to join this, and I'm amazed at the panel of doctors and PadWarriors that are here.
And if everyone who's not speaking can make sure to mute your mic so that we can hear him a little bit better, that would be amazing up until the point that you're going to say something so that we can hear Rodney just a little bit better. Rodney, why is it that you wanted to do this? You wanted to set the stage, for all of our panelists as to why this is really important, that, PadWarriors each presents uniquely and should be treated as such.
Exactly. One of the things I've been hearing lately is they want to have a standardized approach to treating PAD. And in my eyes and from my experience of dealing with it for multiple years, everybody is different. It's just like I may have extreme at the onset of my PAD, I had extreme burning in my toes. And it literally felt like somebody every night when I tried to go to sleep was under the bed, and they would reach up with a blowtorch and put it under my toes. And I'd have to get up, sit on the side of the bed, let my feet dangle to get more blood flow, and then I'd lay back down for a few minutes and do the same thing over again. But before I forget, one of the things I wanted to touch on as what everybody was talking about before we presented was, going to the doctors and multiple doctors getting second opinions, third opinions. One of the things that I found really difficult was that being on disability, my insurance would not allow me to get third, fourth opinions. They allowed me quite readily to go and get a second opinion. But once it got past that, their mindset, it seemed to me, was, well, we've given you the opportunity twice. So, deal with that. Another thing that I think is very, very critical between the doctors and the patients, doctors need to speak in a way that we understand. I'm not saying pull out the crayons and a coloring book, but we don't have any medical knowledge as far as anything else but what we're going through. And it seems to me to be imperative that the doctors make sure that we understand what they're actually saying, what they're meaning. Because if I sit there and the doctor's talking to me in the same language that he speaks with his colleagues, that just boom, goes right over my head, and then I start, unfortunately, tuning out, So as long as I can understand what they're actually meaning, that's a good report to me.
And the fact that they do take the time, which is important, 15 minutes obviously is not enough. What would you like to be covered in those 15 minutes that are not being covered? That's a loaded question. I'll give you that.
Yeah, it is. I'd like to be given informed on and 8 minutes allowed who can help you with this.
I want to make sure that everyone can actually hear him. Is it just my audio that is breaking up, or is everyone?
I'm not able to hear him very well, Kim.
Okay. Ronnie, you might want to get the audio, just double check there, and then we'll come back to you in just a moment. I'm going to put you on mute for just a moment, and then we'll come back to you.
Kim, can I say something about what Ronnie is saying? Because and I love that you have really some of the best physicians around the country. The panel that you have here today, those colleagues of mine, they're really amazing and awesome. And we clearly like what we do, and that's why I want to do this. But I thought that this is going to be a very frank conversation, and I think this is already exceeding my expectations. And we're going to be just as truthful and as honest with you. We as physicians, to Rodney's point, we as physicians also struggle with some of our peers that don't necessarily treat this type of illness to the same level of complexity and illness. And let me elaborate on that a little bit. There's a lot of advancement in the technologies that we can use to salvage limbs and treat patients and make them feel better. And that happens within the last 10, 15, 20 years, actually mostly the last 10 years. And a lot of the physicians that really, just engulf themselves with that technologies and realize that these are some of the things that we can do and help with patients, regardless of the specialty. But what we have observed, even amongst ourselves as physicians, that some of our peers that have not necessarily immerse themselves in these new technologies have struggled quite a bit to realize the lost potential in helping patients like Rodney. And I'm going to take something that Rodney just said. He was describing his symptoms. And if Rodney goes to a physician that does not necessarily treat this on regular basis, the book answer says, you know what, Rodney, I don't think your symptoms are real. I don't know anything about the clinical situation with Rodney, but I'm just assuming that he has bad peripheral vascular disease and critical limb ischemia. Someone is going to listen to him and say, you know what, this might not be related to circulation. That was the first opinion. And he might refer him to a colleague of his within the same practice or within the same institution. And as a physician, they're going to struggle saying or disagreeing with their colleague. And at the end of the day, I believe that 99.9% of the physicians, they truly want to help the patient. But you don't know what you don't know. And if you don't know that people present in a different way, people describe things in their own terms. Rodney's saying, someone is holding my toes to a torch and burning them, and I have to sit at the edge of a bed. Someone else might say, well, my toes are hurting. Someone else might say that I feel pins and needles. So each person describes things differently. And we as physicians that deal with this have not done good enough job in educating our peers and saying, you know what, you need to pay attention to the different way people perceive or objectively perceive discomfort or pain when it comes to peripheral vascular disease. I don't know, Rodney, if you have back your audio, but I'm really curious to hear more about your experience.
Rodney, do you want to give it a try again?
Yeah, and I want to make sure, especially the doctors know that I am in no way bashing. I had some really doctors when I finally got to the right doctors that were. But yeah, you know exactly.
You know what I'm thinking, Rodney, is I think you actually have your phone is probably nearby your tablet and they might be interfering with one another. So you might want to give that a try.
I just threw my phone away.
We're still getting some interference. Why don't you try it again on your phone and then come back on in a second, and we'll move on to, we'll come back to you in just a moment and see if you can log on,
Okay.
log back off and then log on. And let's go to Derek and Tony. Derek, if you want to jump on, this is interesting because I actually met Derek through his wife, Tony. And, you know, Tony came to us through the group, you know, in a dire situation with Derek. And she said, oh my gosh, he's getting his toes and his foot and everything amputated at a high rate. Like, how can this whole thing stop? So I want to see if Derek can jump on.
I can. See us?
Hi, we can. We can see half of Tony. We want to see full Tony. But hi, Tony. Thanks so much, you guys. Actually, it's so great to see Derek, you know, smiling, because it's been a really, really tough journey over the past year. And in fact, you know, you the way you started out, I mean, your onset of symptoms, like you didn't even notice that you had a little black mark on your toe. The onset came when you were getting out of the car and you nearly collapsed. Bring us back to the moment.
Well, first I want to say thank you for having this. This is great, and having us on here. And Dr. Saab and Dr. Mustafa, you guys rock. Thank you for introducing us to them. But years ago, I had back surgery, and the first time I actually felt anything in my leg was about 4 years ago. I was getting out of my truck and I dropped straight to the ground, and I thought it had something to do with my back. I never thought anything was going on with my leg or my foot. And geez, I don't even know how I went from that to, it just progressed from a little sore that I didn't feel on one of my toes. And it just pretty much exploded from there. And
right, you went to a big name hospital, right? And you said,
Yep.
Hey, I need help. And what happened?
Well, they ended up right away pretty much just saying it was gangrene and that the toe had to come off. And, you know, they had put me in the hospital almost right away with it. And I was in there for at least 20 some odd days, you know, and they just started hacking toes with no real explanation other than gangrene.
That was it. And they just kept taking, how many toes did they take before they explained to you that it's peripheral artery disease and that something else needed to be done to fix it?
Did they take 3 of them? I think they ended up taking 3 before they said anything about it being peripheral artery disease.
It seemed like every other day they had him in surgery.
Mm-hmm.
They just kept bringing him into surgery, and then they would
cutting this toe, cutting that toe, or cutting a piece off the bottom of my foot because there was infection in it.
And then they said that they were going to have to cut off all of his toes on that foot. And it was just, I mean, it was just days and days of just amputations and in and out of surgery and back and forth.
Yeah.
And it's horrible.
Was it during this stay that you ended up discovering that it was peripheral artery disease, or did that come later?
I'm pretty sure that was probably later on because, you know, they had me so medicated and scared and freaked out by it all that I really don't remember when they said peripheral artery disease.
They constantly were saying, you know, your husband's got these infections and he's in, you know, critical condition. He's, you know, he never talked about amputations. I mean, they never discussed that what was happening was from a lack of blood flow. Yeah. What was causing this? It was just like, he's got these infections that are going on and we're having to clear the infection. It was never like, we're taking this because we can't get blood flow. It was just like, there's an infection. We can't clear the infection. We've got to go back in. We can't clear, you know, that kind of thing.
And so they're just pretty much making you think that maybe he just stubbed his toe and it got infected and you just didn't notice it. And so you didn't think to ask about any further cause.
No, I mean, like I said, I didn't feel anything going on down there at first. And like what Rodney was saying, he felt fire on his foot. My foot felt like I had it in a bucket of ice constantly. And I kind of always thought that had something to do with my back, because when they went in and hacked up my back and fused all that together, that had something to do with it. But it turns out it wasn't. But yeah, to me, I didn't feel that toe, and it progressed fairly quick.
In fact, we even went back to the back surgeon because we were like, why is he having this foot? Why is his foot, it's like an ice cube? And he kept calling it his ice foot. And I'm like, well, you better go back to Dr. Ahn and see what's going on. And Dr. Ahn said, it takes a little while for nerves to regenerate. So it was like, we always thought, well, this is attributed to his spinal fusion. He was never diagnosed with any heart problems. He was never diagnosed with any vascular problems. In fact, when they finally did say that he had a block, was it by your knee?
Yeah, they had finally said, the first vascular doctor said I had a blockage in my right leg close to the knee, and they ended up putting a stent in that spot, but they had never said nothing about going below the knee or anything.
So but at that point, did they call it peripheral artery disease? And
didn't know when they said that.
At some point they did that. At some point they called it peripheral artery disease. I don't remember actually when, because we were in like such a.
So guys, how long between being in the hospital to the point where you were informed that there's an issue with the blood flow to the leg, how many days have passed? Would you say 3 days, 4 days, a week?
Was definitely after the 22 days. It was definitely
after the 22 days.
Yeah.
So when I hear that as a physician, because I again, I don't know the details, but I bet you that there was some discussion about it among themselves, but the fact that there's definitely a miscommunication, right? There's, again, goes back to Rodney's point that we doctors, sometimes we don't do a good job explaining things to our patients. And what seems like really basic and to us might not seem basic, and it should not seem basic to the patient. So, this is really eye-opening and insightful to me, because we need to do a better job communicating with the people that we treat. So that's 22 days. That's amazing. Wow. Okay.
And Dr. Saab, I have to tell you, at Derek's first visit with his vascular surgeon after he was out of the hospital, I was sitting in the waiting room. The waiting room was filled with people, and I started to look around the room, family members with their loved ones. I looked around and saw all these bandaged feet, and I was looking around the room, just seeing all this heartache, really. And all of a sudden, somebody came to open the doors, and the chairs were like kind of stuck where the doors were at. So I had to get out of the chair, and they rolled this man in. There was nowhere else to sit. They rolled him in a wheelchair, and they turned him around, and I saw his missing leg. And at that point, I started crying, because I said to myself, this is the progression of this disease. I felt like God had showed me that this was the progression. First comes the wounds, and then you lose your legs.
What do you think that the doctors should have done in that moment? I mean, the fact that you had to have that realization yourself, that's scary. Of course, it brought you to tears. What do you think that doctors should be doing or saying, sooner rather than later when it comes to peripheral artery disease, and particularly in your case, where he literally went straight and presented in critical limb threatening ischemia?
I don't know, because to be honest with you, the vascular surgeon that we had was not like Dr. Mustafa and Dr. Saab. Dr. Mustafa and Dr. Saab are very empathetic men, and this surgeon was not that way at all. In fact, he was very abrupt and crass, and he made it hard to even talk to him, because I noticed that he was even talking really down to his staff. So it's like, if he's putting his staff in line, then you're sitting there trying to get some questions answered, and he's, just, it was not a good experience for us at all. I don't know how it would have changed, how it should have been dealt with differently. I just know that it's very easy to be in a situation where you can feel very intimidated, especially in a big teaching hospital like that, where a lot of times they're bringing other doctors in that are getting ready to graduate. And so now you're surrounded by maybe 8 doctors, and they're all discussing amongst themselves, and you just feel like you're
just a number.
Yeah, you're just sitting there, and they're talking amongst themselves in a language that you can't understand.
Yeah, and even more that it made you even more intimidated, and by the same token, it also made you think you were getting the best care. You even more trusted them because they sounded really good.
Exactly.
Yep.
And a lot of money was spent to advertise them. I mean, I see they have huge commercials on TV, and you hear, we live in Indiana, and I'm going to be honest with you. They tell you all the time when different things are happening, oh, make sure you go to this hospital, make sure you go to, it's like everywhere you hear it all around. Oh, if you're having problems with this, go to that hospital, go to that hospital. So by the time that I met you, Kim, and I was in such desperation,
you didn't trust anyone.
And I even told you that. I said, why should I trust you? What is it that, why should I trust you? And I remember you saying, like, I've never heard that before, Tony, but I told Derek last night when we were talking about this, I said, I felt like I was standing at the edge of the Grand Canyon and I had to jump because I didn't know who to trust. And all I knew was Derek was dying. And I knew that for a fact.
And that was the hardest part. And you didn't know which way to jump. You could have jumped back into the same situation. What was the catalyst to make you jump and try something else? Completely different. And especially you guys had to jump into the car for like a 4-hour drive in the opposite direction.
Most definitely. And I'll do that every time. If I have to have more problems going on, I'll take that drive. But what made me go for the second opinion and all that was the first vascular doctor and the first podiatrist. Once they removed these toes, the middle toe, they left bone in by the ball of my foot. And that created a wound, which has just recently been healed up. But they had left bone, and I had gone to a different wound care and a different podiatrist out here by us. And they both pulled bone out of that part of my ball of my foot. And thank God they saw it and pulled it out, because now it's starting to heal up. Plus I did a little bit of maggot therapy on one spot on my foot.
But that you even had to fight for. They weren't even offering that. You had to, again, do all the research yourself. They told you you were in store for yet another amputation. And you said, God, when does this cycle end?
Yeah.
I mean, I've come so far. How do we just put a stop to it and finally get on with our lives? And it took you going online, Tony, and discovering this maggot therapy that no one was offering near you. And, Tony, Derek, you having the courage to have these little, what we call the wee wigglies in there, right? And make it happen. It's been a process. It's been a journey.
It's been a huge fight all the way, and been dealing with this for what now? 4 years? Yeah, going on 4 years now. And
I have to say, I have to give a real big shout out to Dr. Mustafa and Dr. Saab and really the whole staff at the ACV Center, because I was looking when you referred us to Dr. Mustafa, I looked on YouTube and found a TED Talks. And I literally, Derek and I sat in this living room and sobbed because I said to Derek, I said, God is sending you to where we need to be. This is the man that's going to help you. And honestly, I could not, Derek wouldn't be alive, and he would not have his legs now if it wasn't for Dr. Mustafa and Dr. Saab and everything that they have done for us. I mean, Derek's hiking again and doing all kinds of, he rebounds on his treadmill, on his rebounder, and he's walking and he does yard work, and none of that would be possible if it wasn't for these beautiful men.
I just ain't running any marathons yet.
But I think it's really important. Go ahead.
You know, guys, sorry, Kim, you guys are very kind, but I can't help, and you're not saying that, I can't help but to feel, the doctor in me can't help but to feel responsible, that we as physicians need to do more to communicate. Maybe bedside manner is something that, we struggle with. I've been a patient before, my family members have been patients before, and I can tell you bedside manner is, you cannot teach that, but I can't help but to feel responsible, that while I feel privileged that we're able to help some people from quite a distance, I really, there's always this gut wrench feeling inside of me that there's not enough of us out there to help physicians. I mean, there's pockets over there and efforts of this group and Kim, people like you who are advocating for each other, but I can't help not to think about the other people that don't have access to this type of support and this type of community. And what do you think could have made a difference in the way you talk to that physician? And I will tell you, and you're not saying otherwise, I will tell you, a lot of these doctors, they actually might be decent, good doctors. They just have horrible bedside manners. And, at the end of the day, they try to help people. That doesn't excuse their behavior. I mean, I'm the first one to say that, but it just goes to show you that, people forget that you have to be kind at the end of the day. This disease is like cancer, deadly disease, and some of these doctors don't realize the implications of that, even though they treat it every day. Some of them treat it every day. So do you think there's anything that you guys could have said to that doctor that would have changed his approach or changed his mentality or changed the way he was presenting things to you guys? I'm curious.
Honestly, in my opinion is he was just not that of a compassionate type of man. He might have been a decent human being, but he just was not that type of doctor that you could really talk to.
I think he had a little bit too big of an ego. I think that's what he was carrying around, was a big ego.
Yeah.
Probably just didn't know what they didn't know.
Yeah. Yeah, and that's exactly it, Kim. I didn't think about that point, because at one point when Derek was rehospitalized again for another wound, because they never said, hey, they told us, oh, I opened him up. So I'm thinking, oh, really? Okay, he opened him up. I didn't realize that they only opened him up from the groin to the knee. So I'm asking the wound care doctor, I'm like, Dr. Price, I'm like, what is going on with these feet? Like, why is he having these wounds if everything's opened up? So we were told that he was opened up. And at that point I had joined the group and you had given me questions to ask. And I remember asking him, and I said, doctor, because you said, ask him, you put it real bold, ask him this, you gave me the questions. And so I asked, I said, is it that you don't do this? Or are you, not trained at doing this? And he said, we don't do it. It's radical and we don't do it.
Yeah, and that's really important point.
Yeah, never explaining that somebody's doing it, never explaining that, yes, it is being done and I don't do it. It was just a matter of like, look, if you want an answer, no, it's radical, And
I want to tell everybody, because this is also what our small community of physicians that does this kind of work is battling with. on one end, we're battling with our peers, but also we're battling with the perception that what we are doing is radical or it's out there, where in reality, all of us feel that it is not radical. It is not out there. It's actually should be the standard of care for a lot of patients. And we, this is a frank conversation. We're struggling in how can we deliver this message in a way that people can accept it. Not that, you don't want to elicit a response or a challenging response or harm anybody's ego, physicians, companies, but how can you deliver that message to some of the peers, to even payers and insurance companies? I know Mary Yost is on with us, and she's I don't know if she's able to talk to this, but even payers sometimes, because these physicians in some very respectable places and positions, as they should be, they're not necessarily up to date on some of these techniques. And when they talk to payers and insurance companies, they might tell them what they actually told you guys, Tony. This is this is very advanced, or this is kind of not tested, or whatever it is that they might say.
Dean.
And that's really harmful to what we are trying to do and what we're trying to do to help other patients. Mary, I don't know if you're on with us or not. I would love to hear your comments about that.
Yeah, I'm
I think
on.
I got it forwarded.
Yeah.
Mary, you might have
here.
to either turn off your phone or
First
silence
of
your
all,
phone.
this is an amazing story. It's my internet connection.
Oh, sorry.
My phone isn't on.
Oh no.
Can you hear me at all?
It's doing a
If
little bit
not,
of a reverberation.
We'll just move on.
Okay, we'll come back to you if the internet gets
Yeah,
better.
well,
Feel free
then
to
maybe we
chime
should
in.
move on to somebody else.
Okay, maybe you could put a few notes in the chat area as well. I have one more point with Tony and Derek that I really think is very, very important. That is missing when it comes to everyone's trying to research CLTI and what is the patient experience. And I think and where is the gap? And the real gap with the CLTI patients, I think especially right now in their case, is the gap between the podiatrists or the wound care specialists and the vascular specialists that the vascular specialists get the flow going, and then there's a gap in wound healing with these patients. Tony, you became a permanent caregiver in a sense, having to deal with these wounds on a daily basis with absolutely no support. Can you address that and what doctors need to know about that experience for someone with non-healing wounds?
Yeah, definitely. I learned a lot from the wound center at that hospital that we're in, really about just keeping the wounds clean and being very diligent about checking his feet every day and making sure that I got the right products from Amazon. And I mean, I have a whole process of just the way I wipe my gloves with alcohol and wipe all the utensils, the scissors and everything, but really being diligent about taking care of those wounds and keeping everything wrapped up so nothing can get in those small little holes. Sometimes even just the small little fissures in the skin have to be wrapped. And I think that there's a lot of conflicting. You go to the hospital.
You're a professional now, Tony.
Thanks to you, Kay.
And that's nurse practitioner Kay, who's there, and she's been coaching. She works with The Way to My Heart. She's also a PadWarrior herself, and we're trying to fill the gap. That's in wound care, which is that real time. And nurse practitioner Kay has been with Tony and Derek every step of the way, even with the maggots, to really try and heal these wounds. Which you've gotten to ring the healing bell, haven't you, Derek?
Yes, I did. I told him I was going to ring it completely off the wall. But
Can I ask? I I'm gonna be selfish, guys, because I never get this opportunity to sit with a group of patients, and I really want to learn from you because I want to share something personal with everybody. You know, when you have to be a certain type of personality when you do this kind of work, and I don't know if that's a good thing or a bad thing, but at the end of the day, you know, we are professionally invested, but we're personally invested in the well-being of our patients. And we have been told, and I don't mean that as an inflammatory comment, but I want to hear from the patients. You know, we've been told before, you know, why do you keep putting the patient through this over and over again? Because, you know, when we get the patients that come to for me, in my practice, we get the patients that you know, been told that there's no other options. And we have to really fight with them. And we have this conversation, and it's a constant battle. Every 2 months, every 3 months, we have to do something. You know, we know who they are, they have our cell phone numbers, and so on and so forth. And we've been told that by some physicians and some people in the healthcare industry that why put the patient through this? Why not offer them amputation? I know that's going to sound like cliche, but does anybody feel that despite going through this over and over again, or going through the procedures over and over again, does anybody feel like it's not worth it, that they would rather? I know it's going to sound drastic, guys, but I really want to, I just want to know, for me, does anybody think like, maybe if I get an amputation or major amputation, get this over with, and I can move on with my life? Anybody feel that that's a better option?
Well, first, let's start with Tony and Derek on that. Derek, what do you think?
No, I mean, if for some reason I get clogged up again, even if it clogs up 100 times, I'd much rather have this procedure done than any kind of amputation. I mean, I've just got a few toes missing, and I'm sometimes I'm in here and I'll do the 2-step across the room and, you know, lose my balance, and that's with shoes on. So I couldn't imagine having a foot gone, or the leg, part of the leg, or the whole leg. For me, I'll take that drive to see Dr. Mustafa and Dr. Saab. I'll take that drive every time if I have to.
And Rodney, you have a different perspective.
Yeah, during the time that I was going through this, it was quite a few years ago when it started, you know, but when it came to the point where I got such a bad infection in my leg, I mean, I could not find the right or enough painkillers to make it stop hurting. And, you know, I was under a lot of constrictions as far as what my disability would pay for. And when it came to the point where the doctor said, you know, we really don't see any other option other than amputation, you know, I had already built my mind. My mindset was already there. Whether there was another option still, I didn't know, but I had already prepared myself for the amputation. And, you know, I had some really good doctors that helped me through that, helped me with that. And, you know, it probably would have been different for me if I had gotten into a car accident and woke up the next morning and my leg was gone. But since I was preparing, or, you know, it didn't seem that drastic because the pain was gone. I didn't have to lay in.
Don't you think that's where the gap is, Rodney?
Say that again. I'm sorry.
Don't you think that's where the big, don't you think that's where there is this huge gap between what the surgeons do, and then there's a lack of pain care, there's the lack of wound care, there's the lack of, it takes maybe 6 weeks to get back to see your doctor, and in the meantime you're on your own at home, and that's where the big problem is. And if we could address that problem, and people wouldn't have to experience the pain.
You are so right.
I feel that in America in particular, there's this massive big gap. And if we could fill that gap, the doctors could do their job and the nurses could do their job, and the wound care could fill in the gaps, and the patients would be a lot more comfortable, because remember, when you get to that stage where the only option is an amputation because you think that's going to make it better, how do you think you're going to heal from the amputation without pain, without the discomfort? And are you going to survive the amputation? Because that's a radical piece of surgery, and you have to make sure the blood flows there to start with. And that's my biggest problem, not just in the USA, in the UK as well. There's a huge gap.
Oh, I agree with you 100%. That gap sometimes is enormous.
Dr. Saab, I think that maybe answered how as a patient, as a patient as well as a nurse practitioner, or I should say, 2 seconds, if you can see it. There you go. I'm not a nurse practitioner. I'm called a nurse practitioner because a multitasking ninja is not an official title.
I love it.
Well, you've earned it. You've earned it.
I
Very nice.
have a comment too.
Yes, Douglas. This is Douglas.
That's him that did that.
Now,
And we have
Go ahead,
Douglas.
Jay.
Douglas wants to speak up.
because I have maybe mine's a different point of view too, is that with what I've been through and what I'm living through right now.
No, Douglas, you go first.
There are times that I do think about, I would have rather had that done to begin with is what I've gone through the last year and a half with all the surgeries and what I'm living with right now.
Because so Douglas's story, Douglas had.
You've also had a huge gap in support.
Yep. With your care, there was a really big gap. And I think that that's really, you know, the primary issue that you've dealt with. You trusted your doctor. You ended up with an aortobifemoral bypass that failed. And the doctor said the only option for you, without even performing an angiogram, was an axillobifemoral bypass. And that's what you have right now. And that's what he's contending with. And what they didn't tell him in that, I think he's frozen. I'm not sure. Douglas, you can try. There you are. Chiming in with what you've had to deal with. What they didn't tell you, this was just in this past winter that you had it. And immediately your organs started shutting down because they weren't getting any flow. It was all being rerouted.
Right, and that's and you know, wearing this heart defibrillator now and all of this, there are days that, you know, this has been an amazing conference, but it's also been kind of depressing because for me, because I wish I'd have known this a year and a half ago before I've been through everything I've been through.
Yeah.
I think if I may
I mean, I must admit, Douglas, sorry, an axillofemoral is extreme. And for you to have had to live with what you had to live with without the support until you found us, and how you sleep every night and how it disturbs your sleep every night, the pain you're in, I can't even imagine as a patient, let alone a nurse. And my heart breaks for you. And if it's the last thing I do, I'll make sure that you lose that graft.
Yeah.
Amen.
On a daily basis. I'm curious from Dr. Saab what your thoughts are in hearing. I mean, he is saying, hey, I ended up with this invasive bypass, axillobifemoral bypass, wasn't giving any other options. And you know what, honestly, at this point, I would, in my situation, I would rather have them just cut off my legs versus going through, my doctor telling me that there are no other options. I've given you the Hail Mary and that's it for you. Good luck. See you later.
Well, it's not the options, it's what it's the sleeping. I can't wear blue jeans. I can't sit down. I mean, what I go through now with this graft in me is just, and now I'm looking at what, 3 more surgeries just because of this graft has failed already. And go back to that part, what I got 2 to 5 years to live. When Dr. Oz told me that, and here I am less than 6 months in the position I'm in now.
With no prior angiogram, again, not knowing and not being given options. And now you're finding out, Douglas,
Yeah.
right, that there are a lot of options. And, he's actually seeing, a CLI fighter that everyone's aware of in Louisiana, and who's fighting to help save him and actually doing it percutaneously. So just little by little by little. But to reverse such an invasive procedure is really tough. And so it goes to what we've been talking about this whole time, which is really, getting more doctors to exhaust all efforts percutaneously before putting someone like Douglas through an invasive procedure.
Well, I think one of the good piece of news
because
is
they couldn't clear a bypass.
I think the good news, guys, is a lot of the physicians that lead the CLI community, myself included, have really took it upon ourselves, and I'm just so blessed for you guys to allow me the privilege to be with you today and listen to this, because I got to tell you, there's days when I leave work and I tell myself, why am I doing this? And there are days when I leave work and I say, you know what, this was worth it. And listening to you today is just affirming that, we have to keep the fight going. I think the good news is, from a lot of our, we CLI physicians have recognized that, especially our surgical colleagues, the new generation that's coming out is aware, knows, hears, aware of these new technologies, and they're no longer accepting the classical teaching or dogma that this is taboo and should not be done. They're starting to realize, because they see the patients. I mean, again, you don't become a doctor because you're interested in making people feel better and be successful, and healing. Yeah. So they cannot ignore the fact that you have to learn these things to do it. So we're a lot more thoughtful in terms of, when do we think about surgery and when do we think about endovascular therapy? Our challenge is, the current generation of practicing physicians, including physicians that have been practicing a certain way, until that generation either adapts these new technologies or move on to their next stage in their career, we need to fill in this gap somehow. And our community is growing
as soon as possible.
Or retire.
Our community is growing, but we need your voices to be heard more and more through platforms like this. Go ahead.
And Brenda is another one. I want to bring in Brenda because she had lost hope after 13 angioplasties, the first 6 by one vascular doctor, the next 7 by another vascular specialist. And on that 13th, the surgeon just gave up, saying, hey, it's just too difficult. And he said bypass was the next step. But he refused to do it soonest, as he wanted her to then grow collaterals. And she's already walking, trying to walk, 45 miles going, not walking, but she's on a bike daily for 4 to 5 miles, along with 20 minutes of walking on the treadmill. But, while she couldn't, grit her teeth and push through that claudication daily, she said that the rest pain was just a nightmare. Brenda, I want to, call you in here and to describe, that nighttime pain and your vascular specialist response to your complaints.
It was like somebody was just crushing my feet. And then the crushing was so hard that I would have stabbing pains. And I would wake up, of course, and I would put my feet over the side of the bed, but that didn't help. I had to stand on them. And to stand on them when they're feeling like that was just hard. And by the time I walked it out and got the blood flow going again, I would lay down and it wouldn't be very much longer, and boom, I was up, and I didn't get much sleep, not much at all. And I told my doctor, my vascular doctor, and he just was, yeah, that's going to happen. Didn't really do a whole lot. And then the second time I told him, which was a year later, because my visits were a year apart, and he didn't. And
you had to deal with this. You had to deal with this
rest
pain at night, every night.
Yeah, Yeah, I
Wow.
didn't get much. I had dark circles under my eyes, and I was tired all the time, and brain fog.
May I ask you, like, if he came to you and said, and I don't know the details, but and I want to put you on the spot. If he came to you and said, look, we can do bypass right now, but it might fail in 6 months, it might fail in 3 years, it might not work long term, and we're going to have to go back to angioplasties or endovascular therapy, or it might make things worse. Would you said, okay, I'll put up with the pain, or would you have said, no, go ahead and do the surgery? I'm just curious.
I would have said, is there anything else? I guess I would have been desperate at that point for a different route, because I just couldn't handle the pain, and yet I did not want bypass. Or what he said was, in 5 years after the bypass, I would probably lose my legs. And so I was living with that depression, and that was really hard. Finally, the last time I saw him, he gave me opioids, and that kind of helped me get some rest, but he gave me only 50 tablets. And so I made them last for 10 months. And so that meant I only got a couple nights, 2 or 3 nights a month in sleep. And so then when I went back and asked him for more to get more nights of sleep, just to continue what he'd already started, they said, no, they can't have opioids. So I was like, well, why to give you something that's not good? I was very, very upset and frustrated at that point, and reached out to, I joined the Facebook PADS group, and I reached out to Kim, and then I found you, Dr. Saab, and I found Dr. Mustafa, and I was just so blessed that there was something else out there.
So
And
13 procedures. You had 13 procedures with 2 different doctors. What kept you going back to that same doctor, over and over and over again? And then what was that actual catalyst that made you decide, I need to try something new? As much as I like and trust these doctors, there's got to be something else, and I'm willing to try it.
I kept going back to them because I believed them to be knowledgeable. They were surgeons. They were vascular surgeons, and I let that kind of, very reputable. I mean, they had a very high success rate, and then I also had, at one point I ended up in Mayo, and talked with the vascular doctors there, and they agreed with everything my vascular surgeons were telling me back here. So I felt like, they had the recommendations of Mayo. Man, that to me, that is a lot. What do you do? So what made me finally give up on it was
what did you say?
I went to my primary care physician, and he and I both agreed I needed some sleep so I could heal. And he said, we've got to get you something different. We need to get some more opinions. And so he sent me to a vascular surgeon in Champaign. And then I recommended Dr. Mustafa and Dr. Saab, and he agreed. He said, yes, let's try them both. So the vascular doctor in Champaign, he agreed with the doctor here and with Mayo, but of course I got a much better response when I went to ACV.
And so just really quickly, because we have a few others we want to jump to, what are the lessons that you think doctors can learn from your experience? Because obviously there's a huge difference. We've talked about you have a new house, you're walking like you've never walked before. You actually won our most inspirational and most improved in our last walking challenge, which was huge.
Yes.
So wonderful. What would you suggest in terms of advice for doctors through your experience, or based on your experience?
Well, I think they need to be open to new techniques, and they need to be ready to recommend them to everybody. They need to learn that these are not radical. that these really do help people. And I think that they should never give opioids just as a Band-Aid without a solution, in the background. And just listen to the patient, talk with them and do the testing that's necessary. Don't just, like they just let me go and didn't even test me every year. And the hospitals that they worked for, those hospitals need to be educated as to how good the other options are that are out there.
Yeah, I think
Very good point.
that's really, really important. And I don't know if
How did your mental health feel in the middle of all this? Because I know it's something Douglas has brought up, and I know it's something I went through myself. How did it affect your mental health?
Oh, I was so depressed. I was almost in tears. Well, I was in tears many nights. And my husband was right there holding me and just, helping me to get through it. But I don't know. I think when I finally found you all, I gained some hope, and that's what improved. And then just after my first visit at ACV, I was like on cloud 9, and everything has been just great ever since. But it was hard there in the middle there. It was pretty bad. When I thought I might lose my legs, I was not happy.
So you were one of those that was willing to do the multiple procedures, and you were willing to have multiple angioplasties and keep going if that's what it meant to save your legs.
I'm willing to drive 6 hours, one way to see doctors, these wonderful doctors.
Yeah.
I'm willing to do whatever it takes. Yeah. To keep my legs.
Thank you so much, Brenda. Brenda, you don't have to go away. If you want to chime in again later, feel free. But I want to introduce Chef Sarah again. Sarah, she was 37 years old. So this breaks the whole mold that when we talk about 1 in 20 people over the age of 50 having PAD, she was 37 years old when she was actually diagnosed with PAD, and she had non-healing foot ulcers. Sarah, you sought care at a large hospital to improve your flow. What transpired after that?
So thank you, Kim. Yeah, I was 37 when I first started with the pain. And like Brenda, she said like so beautifully, pain at rest. And it just started in August, like from nowhere. And I couldn't sleep. I was crying every day. And my depression went out of the roof because I didn't understand what's going on. And also I was diabetic. So when I went to my doctor, they say it's nerve neuropathy. So I was prescribed pain, a spray for the pain. And thanks God, this spray burned my foot, my toe. Because of me developing ulcer from this spray, 4 months later, because my ulcer wouldn't heal, I finally was recommended to a wound doctor, to a big hospital. And that day, it was in November, and they finally diagnosed me with P.A.D, like vascular problem. Then week following, I had my first angioplasty. And what I want to say about that is like, I had my first angioplasty and I was grateful because I have finally a diagnosis. It went well, but a couple of days, like a week after that, the pain came back. And even worse, and I didn't understand. So I was trying to reach my vascular at that time, and he told me like, you have to keep walking. You just have an angioplasty. It's gonna take time. You have a lot of blockages, But he did a good job. But the problem that I had with him is like, I told him like, is it another doctor that can help me? Or he said, no, you have to keep walking, So if it wasn't for me joining Facebook, I didn't know about second opinion by doctors. I know what is a second opinion. When I go shopping and I don't like this, I'll go to another store. That's my second opinion. I know that. But I never knew that I can change doctor just like that. And I trust my doctor because, like say, Brenda is a qualified vascular. He went to school for it. So you know what? I'm gonna trust him. Mm-hmm. But I joined Facebook, and Kim say, you need a second opinion. You cannot just be walking, be in pain since August. And I was like, how? And from that point, she helped me, and God bless. They introduced me to Dr. Runback. He was there earlier. And, I explained to him my situation, and he did see that I had a lot of calcification and that I was very small and it would be hard, but he can do it. And that's why I learned from even Kim from Facebook and from Dr. Runback that they're going to do like what is called a pedal loop. They go like below knee and they try to open up those small vessels that are in the toes, because that was my problem.
And here's the thing that I think is really interesting about your story. Until you found us, you didn't know, you were willing to settle for walking with a cane and having a boot on with non-healing ulcers at age 37.
Yeah, because I didn't know better. Like from what my doctor was telling me, he said, with time, you're going to get better. But when a doctor like Ronnie said before, they talk to us like with some vocabulary that we sometimes don't understand. So me, when he told me with time, for me, maybe like in 1 month, 2 months, I'm going to feel better, But no, months, and I'm walking with a cane. I'm 37. I look like I'm, I'm sorry, but I look like I'm 60, 80, and I'm not supposed to live like that. Especially for me being somebody that love life. I'm a little bit crazy. I like to dance. I like to do this. I like to do that. And I live in New York. New York is a city that doesn't sleep. So how am I going to be able to stay like that? No. So, I did the pedal loop, and thank you for Facebook, the P.A.D. A lot of doctors say, oh, don't believe in Google. But, I Google and Facebook helped me. If it wasn't for the group, I don't know where I will be right now, So second opinion for me is the best. And even second opinion doesn't work, you go to third opinion. Yeah. I encourage everybody to do that. Because, yes, the doctor went to school. Maybe I didn't go to school far, but I know what it's like to have pain. They go after work, they go home. They don't know what Sarah is going through, Sarah was the type of girl she enjoyed her life. Sarah became a woman that cried every freaking night because this food didn't want to stop. Like, I didn't understand. Even myself, I was cursing God. Like, why you do that to me? Until that I had the pedal loop. And it took time. It was not easy. I bring my A1C, that's a diabetic number, to 5.1. Last July, it was 10.5. That's bad. Now, I don't take medication for diabetes. My wound had healed. I walk 20,000 plus steps a day, or sometimes a little bit less, because I don't want to lose my legs. Amen. Don't deserve, thank you, Tony. I don't deserve, and nobody deserves to be told by a doctor, oh, you have to keep the time doing this job. No, a doctor, if you cannot do your shit, send me to somebody else that can do it. Because at the end of the day, that's my life. And like Dr. to say earlier, it took a village. Yeah, it took a village to help someone. But you have to willing to help that person. Because if it was you that was in my shoe, you will love a doctor to the best to help you through the pain. Because, P.A.D. is a problem. But I think what is the worst about P.A.D. is to deal with the pain. when you go outside and you have to smile at people because they cannot see crying inside. You know, you have to be brave, you have to be strong, but sometimes tired of being strong because it's nothing that you can do to say to the pain to stop. And I was hooked to painkiller because of my pain. Thanks God now I don't do that. But I don't know what to say. Like, you know, like I have tears in my eyes right now. I went to hell. And I'm so happy that I have like Dr. Runbag, Dr. Saab, Dr. Mustafa, and the two, like those doctors that really take conscious. Like we are human, we are not robot. This is not like a little scar that's gonna heal up in like 2-3 days. Our circulation is blocked. I know I did some bad thing. I drink, I smoke, I eat bad, but I stopped all that. Today, I'm 1 year and 2 months sober. No alcohol, no cigarette, no junk food. I buy everything organic. I use my food stamp, even if it's expensive, because I want to live and I deserve to live like we all do. Painful.
Yay, well said. Well
And
said,
what is
sir.
the role? Yeah, exactly. What is the role, you know, that the doctor plays in inspiring you to do your part, which is doing those lifestyle modifications, the diet, the quitting the smoking, the drinking? What role does the doctor play in terms of giving you that kind of hope? Is it that they take your pain seriously and are willing to work as your partner and intervene early?
I mean, I like that question because even as patients, we have to understand like a big part of our recovery is us. Like, you know, if you have a good doctor, like I had Dr. Runback, he told me the truth in my face. He said, like, if you want to get better, you're young, you have to stop all this, you know, and at that time already been stopping. But he told me this is like a lifelong. You cannot like just today I'm going to decide to go smoke or do this. No, you have to keep doing that. And I'm willing to do that because he was the first doctor to tell me in my face that I have to get better with P.A.D. I have to do that. And his recommendation is working. And I'm going to keep doing that because I don't want to be like, thanks God I didn't have
It's a
stent.
two-way, Sarah. And
I'm sorry.
yeah, it's a
I'm
two-way
sorry.
street, Sarah, and you're an absolute inspiration.
Thank you so much.
You're
and
wonderful.
The good thing about my situation, like thanks God, because I was young also, they didn't stent my leg. I only have balloon and a pedal loop. But unfortunately, P.A.D give me a coronary artery disease. And now inside my heart, I have 3 stents that were placed in February. Not everybody with P.A.D have coronary, but it leads to coronary for others.
But
and
here's,
also,
this
Oh,
is
go ahead.
important though, Sarah, this is really important, that you, you didn't know, no one ever told you that the two are related. It was because you learned in the group that,
Yep.
you know, there was a relation and you took it upon yourself to go get your heart checked.
Exactly. I play like a Detective Columbo. I told my doctor, you know what, I need to see a cardiologist because in the group, somebody said,
Well,
people with
wonderful
P.A.D
comment. You're amazing.
No, so I told my doctor that somebody in the group in Facebook, and I mentioned Facebook group, somebody told me to go check my heart because people with P.A.D sometimes have heart disease. And me, I never had
P.A.D.
symptoms in my heart.
Yeah.
So I go over there, they check my heart, they call me back, they say, hey, you have blockages. And I'm like, what?
Yeah.
I go back, they put 3 stents in my heart.
Yeah.
Go
Thank you
Columbo.
so much. Yeah. Thank you so much, Sarah. I want to jump over to Sunshine as well. If Sunshine can unblock really quick, we want to go through this because we still have a few more really quickly. And I know everyone's tight on time, but I want to get to Sunshine because she's in the heart of Mississippi in there. And, you know, a very, very high rate of amputation. And you had the experience, you're sitting there, you had lost your insurance, you're on Medicaid, and you went to this doctor out of pocket, scrounged up some money to pay. And What did the doctor tell you, Sunshine? What were your options?
Because I didn't have insurance, he wanted me to just check into the ER and refused to leave until I saw him, and he was going to cut off my toe and possibly my leg. And he gave me 2 days to make that decision.
Wow. How did that, what was going through your mind at that point?
Absolutely not. That was what was going through my mind. I got on the internet and I started my research, and it led me to you. It led me to the group, and I just started asking questions, and then you were there. You said that I need a second opinion. You instant messaged me and got me to where I am today.
But there was you had a non-healing ulcer on your toe and no angiogram was ever performed. They wanted to go straight to amputation.
No angiogram was ever performed. They never swabbed my toe.
To find out what type of bacteria.
Right. It started in April, the beginning of April, and it started just my toenail was flaking off, and then the blister appeared. I went to the emergency room. I went to urgent care. I went to a self-pay clinic several times, and nobody would ever swab it. I gave them, I told them my foot's falling asleep at night. I'm having to get up and move around. I have this pain in my calf. All the symptoms that I'm having. And they didn't even do like an X-ray or, CAT scan or whatever. To see, they just, the one lady told me that it was because of my sciatica that I was having this issue with my feet falling asleep and all that. But they never ran any tests to confirm that. They never did any swabbing to find out what was causing the infection.
And what's even more is that she was diagnosed 6 months prior or 8 months prior with factor 5 Leiden.
No, I've been factor 5 for years.
And no one ever told you. Right, but no one ever told you you were at risk of losing your limbs because of it.
No, nobody ever told me that. And like I said, I went to several doctors to, pay out of pocket to try to get back on my Coumadin. And it was a runaround just to get on my Coumadin. Like it had to come to this for me to get put back on the Coumadin. I had one doctor tell me when I said that I didn't have it because of insurance, she said, well, it only costs $4 at Walmart. And I said, well, yeah, but you have to have a prescription to get it from Walmart.
Yeah.
But yeah, I mean, just the runaround. And I paid the podiatrist over $200. And they told me that I had gangrene, and it turned out that it was necrotic, but it wasn't gangrene that I had. And he's the one that sent me to that vascular guy that was just gonna, cut my toe off and quite frankly, probably my leg too, which I hear now that would, with the fact that I was blocked with clots, probably could have killed me if he would have tried to cut off my leg.
And the good news is, and this is where you're at right now, is 2 angiograms later and stabilization with your factor 5, and you're starting to walk again, and it feels really good.
Yeah.
You have hope again.
He got all the clots Thursday. He got all the clots. I'm on Plevix and Coumadin now for the next 30 days to try to keep, the clots from coming back. Of course, he said there probably will be more procedures, but the real issue, the biggest thing for now was to try to save that toe.
Yep.
And we think we've done that, hopefully.
And that's where, Dr. Saab had mentioned earlier that I think that answers your question as well, that, there are a lot of people out there that would rather keep their leg than, and have multiple angioplasties or angiograms versus an amputation, right, Dr. Saab?
Yeah, I mean, Kim, that's I came on today thinking that I might offer like some advice to help. But I wanna tell you and tell everybody here that I feel that you guys have helped me, and I want to thank you, all of you, for sharing some of these really great stories. If you think it's sometimes it's lonely for patients, sometimes it is lonely for CLI physicians out there that are battling with a lot of these issues out there. And I want to thank you, all of you, from the bottom of the heart, on behalf of my colleagues and myself, that you've been kind enough to share your stories with us and really empower us to fight and continue to fight every day. You guys are amazing. Yeah, we do these difficult cases, these difficult procedures, but you know what? You are the ones that go home at nighttime. You are the one who's dealing with the pain. You are the one who's dealing with this constant fear. I and a lot of us feel that it's a privilege to be able to help and take care. I feel that we're lucky to be able to do this. We have a lot of work ahead of us, but you know what? Through this grassroots movement and effort, and people like Kim, Kim and your team, you guys are doing something that's phenomenal, touching everybody's life. So thank you, all of you, for allowing me to be a part of this. And I feel privileged that I've met all of you, and hopefully I'll continue to help. So with that, I'm going to sign off, Kim. I apologize. I need to be on another meeting after 5 o'clock. So have a great day, everybody. Thank you.
No, thank you.
Thank
And
you,
we're going to
Doctor.
continue, and I'll send you the tape of the rest of the conversations, because we have a few more to go that I think are going to be impactful, that I think also Mary and Dr. Gupta and Jim would want to be, to hear. I want to jump to Kay because she is our nurse practitioner, and she's in Scotland. And she's been here from the very beginning with all of us. But I didn't find out that she was a nurse practitioner until just recently, just in the last few months. You came to us as a patient. Okay.
I did, yeah.
And
I came as a patient because we've stopped there. I came as a patient looking for advice like everybody else, because I had P.A.D, and I had been waiting at that point over a year and a half. They tried a procedure. The procedure was stopped because it was an interventional radiologist and he wasn't allowed to touch aortas. They started to operate, discovered my aorta was blocked, and stopped. And then I started the waiting game. I had a slight heart attack while I waited, and that was just pressure on my heart. And if it wasn't for the group, I, like everybody else, suffered mental problems. I was depressed. I had more anxiety than depression. And I too was up every single night, screaming, crying. I had a piece of furniture standing beside my bed so that I could grab it and stand there. And my neighbours think I'm crazy because I'd be walking about the garden at 4 and 5 o'clock in the morning trying to get the pain away. It's something I can't describe, but I would like to say I'm also allergic to painkillers. So even paracetamol. So I was never given anything that could actually help apart from antispasmodics. The good news is I found my own hero. I paid for my own CT scan, and I then sent my disc around and I found my own hero. And on Thursday, I too had my procedure. I now have 3 stents, 2 and 1 in each iliac and 1 in my aorta. And for the first time in over 2 years, I have pink toes that can wiggle and can move. And I feel the relief and the admiration that everybody else feels in this group. And as a nurse, as well as a patient, I'm overwhelmed, but I couldn't be happier.
And I think you skipped over some important parts in that story. Of course, definitely you got right there to the wonderful, happy ending that we have all been waiting for, because all of us, you see Tony and Derek and Sarah and Donna and everybody just and Sunshine, like we've all been cheering you on, is you've been helping everyone here in the groups. You know, you've been suffering yourself, and it's been incredible, but you missed that part that doctor had marked you as palliative, which that's why no one else would touch you.
I have lupus. I have diabetes type 1. I have what's known as MACUS, which very few doctors know about. And so the vascular surgeon had put across my case notes that I was palliative care only. And that's why nobody else would even look at me, let alone give me a second opinion. Because I was written off just to go. That was it. And I refused to give in because I have a family. I have a family online here that I love to look after and help. But I have my own family, my 2 daughters and my grandchildren. I have a husband that I adore, and I was not ready for going out that door yet.
No, not at all. And you've said it best. PAD is people, and I think that's what everyone forgets. Is PAD is people. Everyone has a story to tell, right?
Yes, every single one. And it's not just the pain, it's not just the PAD, it's also the mental anguish that everybody goes through. It's the gaps in care. It's just the whole thing needs sort of rewritten slightly. And if I could help fill that gap in any way, shape, size, or form, then I feel honored. And for every time we save a leg, whether it be in the Philippines, whether it be in Mississippi or whatever, that makes my day worthwhile. Tony and Derek, I love you to bits. You've become the most amazing friends. Sarah, Sunshine. I just can't say a big enough thank you to every single one of you, because not only did I help you, but you've helped me. You helped keep my mind focused, and you help keep my mind off having PAD and my problems too. And I love you all.
You make me cry, KK.
Yes.
Piggies, go pink piggies.
It works both ways, guys. It works both ways.
And you were offered, the other part of it is you were offered multiple bypasses, and even the axillo bifemoral bypass, that Hail Mary of all Hail Marys. And you kept fighting.
Yeah, I was offered an axofemoral bypass. Yeah, and I said no, not under any circumstances. I said it's a death sentence. And he said, well, that's true. We normally only offer it to palliative patients. He offered me a fem-fem, and I said no. And he said, why? And I said, because there's no bailout from a fem-fem, apart from another fem-fem. So no, I held out for the one and only pedal loop specialist in Scotland.
And everything was working against you. I mean, not only 19 months later, but then you get your surgery scheduled, and then the surgeon breaks his arm, and then you have to wait beyond that. Then it's shut down because of COVID again. And then beyond that, they bring you back, and then the anesthesiologist was giving up on you. So you get to the hospital, you're in your gown, ready to go. And the anesthesiologist says, I think that's just too complicated for me. And I want a bed for you and blah, blah, blah. So they sent you home again. And finally you came back.
Yep.
What kept you going? I mean, that you mentioned the mental anguish. And I think this is something that's really important for everyone, to understand, especially in the industry, that it's real. And there are these large time gaps between treatment and, what's another week? What's another week? What's another week? But you're up almost 24/7 because of the pain. Those weeks feel like months and years.
Yep.
19 months and 11 days.
And it sounds like, I don't know, Rodney and Sarah might want to chime in there, that that pain is real. And, even waiting, 24, 48 hours between the onset of, that serious pain. And then the doctor saying, oh, okay, well, I'm going to schedule you for a week out, or let's see you in 3 months. It's almost mentally hard to deal with, which doctors wonder, well, why are they still smoking? I think Marie was still here. Like the doctors go, well, why are you still smoking? Well, the stress, the pain, the anguish will, even though you know it's bad for you, it'll keep driving you with such a large time gap, to smoke, right, Rodney?
Also, one of the things I found with the non-smoking is that, it is an addiction, just like all other addictions. But one of the things that separates smoking from
20 times more addictive than heroin.
Yes. And, a heroin addict or an alcoholic, they don't do that 24 hours a day. We smoke just about every hour that we're smoking, quite heavily. And it becomes so ingrained in our being. This is just my opinion. It became so ingrained in my being that being able to stop was, that seemed astronomical to me at the time, But, going from another point of view, with the constant pain, and I didn't have rose-colored glasses on, but the one thing that got me through, well, two things, a good support system and positivity, a positive attitude. That helped me so much. I was dealing with the pain. I was dealing with the frustration, but I tried to keep myself positive, not saying, oh, well, it's going to go away tomorrow, but I can make it through this today. And that just helped so much for me.
Does anyone else want to chime in there?
Yeah, I want to say something. About the pain, actually, because everybody experiences pain, and people look at you like you're crazy, But I thought personally, like a hair break was the worst pain in the world, losing like someone that you love, But seriously, P.A.D. pain is the worst pain I ever experienced in my life, and I'm still traumatized by it. At this moment, my right leg is starting to show symptoms. It's not painful, but I have a scheduled appointment with Dr. Runback so I can do another angioplasty, because I don't want to go through when I went through last year for 4 months. I cannot do that, because seriously, that can take somebody to the verge, like, I don't know, like, it's crazy. Like, nobody can actually describe the pain, because the pain do a lot of painful sensation. It's either tingling, stabbing, burning, shooting. Like you go through like this, like even your mind become even crazy, because that's why when you go to the doctor, you don't even know, like, like you feel like it's like this, it's like that.
Yeah, extreme and constant pain definitely can change you.
Yeah.
And it's like you said, it's just undescribable or indescribable.
And Julie's even sitting there in the background and totally agrees as well. And I want to jump in. Donna's been sitting there in the background. I know that she's been dying to say something in here as well. Donna, you just got to persevere. You got to walk, Donna. Just walk. Keep walking.
I am. That's what I'm doing. But I've got some faith now that I'm going to find a doctor here in Morgantown and get the treatment that I've been needing so bad, and the answers, and know that I have a doctor, period, that's watching over me.
Yeah. And that's good. And it's just, it's scary. There's a lot of anxiety, right? That goes between, the time that you have, the diagnosis to getting some sort of treatment. That waiting game literally can be devastating.
It's taken its toll on me, to say the least, and I can sympathize with other people. Like I said, I've lost 40 pounds now in 3 months. I was from 179 to 139. Woo-hoo. And most of it due to stress and anxiety. Of course, I've changed my diet, and I actually, we're talking to you now, I'm on the treadmill, walking. And I'm just waiting and holding my breath for that call, for that number to that doctor. And so I can breathe.
Yep.
And you will.
I know,
You will. I told you, we're with you every step of the way. And as you know, if I was hoping if, because I see multiple iPhones on here, if Douglas or if Victoria and Shane Driver are on, would love to get their perspective as well before we have to sign up off in a few minutes. But if anyone else wants to speak out right now, just go ahead and jump in, because I know I've been yammering away. You guys hear me enough, right? But while we're
Oh, did you say something, Kim?
Well said, Rodney.
But I want to also get to Kay. Kay, you've worked with everyone, you know, around the world, and I'm curious, just if you can summarize some of the major gaps that you think still need to be addressed based on your experience. I know the one thing in talking to Tony and Derek that there's that huge gap in real-time care, wound care, and everyone's wondering and wanting to create these big societies and get multidisciplinary teams together and whatever. And the real gap actually for CLTI patients is care. It's actual real-time care on a daily basis. And you know, please go ahead and take the floor and talk to those and summarize some of the key things, including that.
Well, I know he's online and I know he's listening. So I want to give the biggest shout out to Don Don. Don Don is in the Philippines, and he had one of the worst cases of wet gangrene I had ever seen. And 4 doctors wanted to take his leg from the bottom, from his knee down. And that man, 3-4 times a week, was on the phone to me. He watched every Wound Care Warrior episode to date. And we managed to get dressings sent all the way out to the Philippines. And he instead of losing his leg, he lost the top of his pinky toe. And he's just became a daddy to a brand new girl, a wee baby girl. And his toe was healed. His toe was healed in time before his daughter was born. And I would just like to say he's one of the strongest men I ever met. Derek 6, you are definitely up there as well. I have never known somebody that put up with the wee wigglies so bravely as you did. And Tony, for you to have to look at that and sleep in a bed knowing they were in his foot, I take my hat off to you. For Sarah to limp her way around New York is bad enough when you're able-legged to work your way around New York, but for you to do it every single day, hats off to you. To every single person out there, to Sunshine, to Darlene. I don't think Darlene's out here anymore, but we saved Darlene's leg recently. And she was
weeks ago.
A couple of days off an amputation. And for each and every one of you, for putting your faith in me and for listening and for doing everything that you could to improve your own lives, I want to say thank you. And I want to say it's been the biggest honor, because there is a massive gap between leaving that doctor's surgery, having had your procedure, and waiting till you see your doctor again and being left on your own. Gangrene, I have never seen dry gangrene or mummified gangrene in my life before I started helping Kim. I had heard about it, but I'd never actually seen it. And I'd heard about it in the past tense, in his historical comments, not in modern day. And to see people in modern day life having mummified toes so that they'll autolytically debride is nothing short of barbaric. And it's, for every last breath that I've got, I will continue to help every single warrior on this page, because you lot kept me sane. You kept me busy. You kept my mind active. And I am grateful to each and every one of you. But mostly, I am grateful to Kim McNicholas, because
Hell
you
yeah.
ladies.
Yes, yes.
Yes,
Right on.
Kim.
We love you, Kim.
We love you.
Yeah.
We
Yeah.
was all
You-
safe.
We love you.
Kim, she's the queen of
And it-
California.
Yeah, found out.
Now, if we can
I
just
came as
get
a
her.
patient. I am here now as a nurse. But if it wasn't for you, I'd never have kept fighting. And I owe you my leg.
Oh,
Thank you.
I
Cool.
don't even know what to say because,
Awesome.
you know, PAD is people. And every single one of
And
you
people-
is family.
Our patient.
Every
is
single
patient-
one of you,
patients.
you inspire me every single day. Every single one of you inspires me every day. With every text, with every phone call, with every post, with every message. Donna is so adorable. She apologizes to me all the time. No. You don't apologize. When I see you, when I hear from you, Bob's on here as well. He still apologizes. No, you message me, you call me, you post, you put up the SOS because I know you're fighting. And with every fight in you, you're inspiring me to work harder every single day to fight for you because you're people, you're family. No matter where you're at in the world,
But Kim,
you matter.
Kim,
You matter.
Couldn't do it without
Kim,
you guys. You and Kate, either one.
Kim, you're
you are
awesome.
the way to our heart.
we love you.
And I couldn't do it without my partner in crime, without nurse practitioner, Kay. I mean, you've inspired me from, the very beginning. And I literally, I wish I could have just, if it wasn't for COVID, I mean, I would have been on the first plane out there. We were ready. We were working on, getting our visas and getting over there to come and knock on these doors. And I even reached out to your doctor personally to say, you better take care of our girl.
And I have to
And he
apologize,
did.
Kim. I know you get tired of hearing that.
You're
But I had-
apologizing again.
I had doubts today that I was going to get a name or something from West Virginia. I have to be honest. And I just thought they're not going to know anybody from West Virginia. There's just no way. And when that doctor chirped up and said, hey, I've got a colleague I know in Morgantown, I underestimated
Oh,
you.
no. Miracles happen every day on
Every day.
the way to my heart.
Yeah.
I-
And Julie,
I know
as you
you're
said, we
right.
are all family.
I know you're right. I just want one so bad. And I'm just waiting. And today, I feel like I got my miracle and that it's coming. So, again, thank you, Kim. I just can't thank you enough.
And I love that you're up there walking.
Oh, yeah. I've been
You're
taking
here and you're
breaks.
walking every day.
Oh, yeah. Every day. Well, I walk every day.
I want to give the floor if there's anyone else that hasn't said anything that that might just want to finish out. I hopefully we won't get cut off in the next 4 minutes by our platform, but I know that there are several people on here that are such fighters. Bob has been a serious fighter through this. They offered him invasive procedures, multiple ones, and he kept fighting. He kept searching. And I know Jim left, and I wanted to introduce Bob to Jim because Jim's company, CSI, provided, the orbital atherectomy device that helped him with his right leg, finally getting that going. Still not in the clear, I know, Bob, but we're in this fight. Every one of you, we're in this fight together, and we don't give up. I'm not giving up on any one of you. And, I work for you. I work for you and I work with you. And I want every single one of you to know. And Kate, you feel the same way, right? I mean, whatever you
100%.
need, you have to let us know what we can do for you. please, be honest with us. We want you need to be heard, and you are creating the change that you want to see right here and now, just showing up, just being here today. You heard Dr. Saab. You had a world-renowned PAD researcher, Mary Yost, on here. You had, the head of the Stand Up Against Amputation organization in partnership with one of the largest and most used atherectomy devices that was here, a company that makes that. I mean, they're hearing you. You were brave. You stood up, and let's keep this fight going.
Can I say something real quick?
Yes, please.
I wanted to tell everybody on here that fight, fight, fight. You guys have so many options these days. I didn't have quite as many of those options. I am an amputee, but I go on. But don't settle for anything less than the best and the most you can get.
Man.
You're there, right?
Thank you.
Yeah, that's true.
Thank you,
Thank you.
guys.
Thank you. I mean, I couldn't have wrapped it up better myself, honestly. And, Rodney, thank you. I know we had some audio problems. I hope that you've been able to say what you wanted to say. And, with any.
Oh, sorry, just an audio problem.
But any final thoughts, anything, if anyone wants to shout out some, last pieces of advice for especially whether it's PadWarriors or doctors, anyone who hasn't spoken, but also Rodney, Kay, Tony, Derek, any final thoughts before we go?
My roommate said, thank you, Kim. That's my roommate.
I love it.
Thank you.
Is that a Boston Terrier or a French Bulldog?
French Bulldog.
Ah.
I draw the line at buying you something that pees and poos, Sarah.
Hey, but it'll make her walk even more.
I know, right?
She walks enough anyway. We're not giving her one of them things that pee and poo. If I had to say one last thing, is I'm grateful that the older generation of vascular surgeons are finally giving up the ghost, and that we have the new young endovascular surgeons that are doing the job that they're doing, because each one of us is still here because of them.
Yes, exactly.
So yes, PAD is patients and patients are people, but we wouldn't be here if it wasn't for the doctors that are working on our behalf. So as well as patting ourselves in the back and keeping our own spirits up, we must always never remember or forget the doctors that have helped each and every one of us, because 10, 20 years ago, they wouldn't have been there and we'd all have been amputees.
And one thing that I would ask, and I think that even Dr. Saab was saying, is that I think if you're looking for a takeaway and something more that you can do, as Kay said, that we've been blessed here in knowing that second opinions are possible. And we've been blessed here in knowing and getting more information on what is possible. The best thing that we can do is, number one, go out and spread it around to other PAD warriors out there, getting the word out about what is possible and encouraging a second opinion. And number two is going to your vascular specialists, going to your general practitioners and educating them on what's possible, because you never know. I know I've been in with Bob on some of his appointments with his general practitioner, and he educates him. And so because of that, his general practitioner is actually now going and helping even more patients. So you have the power. You have the power. So I think together, I think that we're going to create the change we want to see. And I thank you very much from the bottom of my heart for allowing me to be a part of this journey and this fight to save life and limb.
Yes, well said.
Thank you, Kim.
As all the young kids say, whoop, whoop.
You're right.
I love you
rock,
guys.
Sarah. You rock. You rock. Sarah.
Thank you, Derek.
Thank you so
Bye.
much. Bye.
Thank you guys. You
Thank
guys are
you.
Thank
amazing.
you.
Feel free to follow up with me afterwards. And, you know, however I can help you. As I said, I'm here, and whatever you guys need from Kay or I to help, you know, educate other people, please let us know. What is the information you need? What do you want to share? How do you, you know, want to help others? You know, we're here. Just like Rodney spoke up and was like, hey, I want to co-host with you. And it was like, you know, let's do this.
Yes. And it was an eye-opening and heartwarming experience.
And you did it well.
Thank you
Yes,
very much.
thank you all.
Sarah.
Stay blessed.
Yep. Keep your
Very
voices heard. Keep your voices heard, raise them. And if I think that we need to have a little kitty for every single time Donna apologizes anywhere.
I agree. And we also need to have another kitty because we need buckets of love, because Douglas had to cancel, as you all know, this week, and hopefully in a fortnight he's going for his surgery again. So we'll start putting money in the kitty for Donna every time she apologizes, and buckets of love in another kitty for Douglas, so that we can get you both through what you need to go through.
Hey,